Dr. Samuel Davis, orthopedic spine surgeon with Palmetto Bone and Joint in Chapin, South Carolina. And today we're going to be talking about cervical disc replacement. So who is a candidate for a cervical disc replacement? Typically those patients are going to present with neck pain or neck pain that radiates down the arms. A lot of times they may present to their primary care physicians or some of my colleagues for that initial treatment. And that initial treatment by our spine team could include physical therapy, epidural steroid injections, or other modalities to try to alleviate that radiating arm pain. If those particular modalities do not work, then folks typically come to me to discuss surgical treatment. The cervical disc replacement is a great option for folks that are active, and it also allows us to maintain motion at that particular segment. The traditional treatment of a herniated disc, which is the usual culprit for that radiating arm pain, is an anterior cervical discectomy and fusion. That involves fusing that segment that we're operating on, which leads to increased stress at the levels above and below, which could lead to future surgeries. With an anterior cervical disc replacement, we're looking to decrease the chances of that adjacent level degeneration. The process of an anterior cervical disc replacement is the same as that for a disc fusion. However, again, we're sparing the motion at that segment, allowing folks to get back to doing the things that they enjoy doing a little bit quicker, and certainly with that same range of motion that they had before surgery. So if you're suffering with any of those symptoms and think that you may be a candidate for a cervical disc replacement, I would love for you to come down to Palmetto Bone and Joint, where our spine surgery team could evaluate you, your MRI, and your other imaging and decide if you are indeed a candidate for that particular procedure or any of the other procedures that we perform here. Cervical disc replacement, just another example of how Palmetto Bone and Joint of Chapin, South Carolina is on the leading edge of spinal technology and innovation for the patients of the Midlands of South Carolina and all of South Carolina.